Good morning, everyone. My case is Mary Burns, a recently divorced 35-year-old, is seen in a clinic today complaining of anxiety and inability to sleep at night. The primary care provider writes Miss Burns a prescription for diazepam Valium 5 milligrams 3 times daily and also for triazolam Halcion 0.25 milligrams at night for sleep when needed. As Miss Burns' nurse, you are responsible for developing a teaching plan for her. Consider what additional information from the patient might be helpful and discuss your plan. So for the breakdown of case, Ms. Burns, a recently divorced 35-year-old, is seen in a clinic today complaining of anxiety and inability to sleep at night. So the primary care provider writes Ms. Burns a prescription of diazepam 5 milligrams 3 times a day and triazolam 0.25 milligrams at night when needed. So the task is to consider the additional information that might be helpful from the patient and to create a teaching plan. So first is diazepam. Diazepam is used to treat anxiety, alcohol withdrawal, and seizures. It also relieves muscle spasms and provides sedation before medical procedures. This medication works by calming the brain, and it also belongs to the class of drugs known as benzodiazepines. So benzodiazepines are a class of drugs used to treat anxiety. So next is triazolam. Triazolam is a benzodiazepine similar to Valium, and it affects chemicals in the brain that may be unbalanced and cause sleep problems, thus it is used to treat insomnia. So for the side effects, for the similarity side effects of the diazepam and triazolam, they both can cause dizziness, tiredness, and drowsiness. And for diazepam, the side effect is muscle weakness, ataxia or involuntary muscle movements, tremors, dry mouth, nausea, and constipation. For triazolam, loss of coordination, depression, memory problems, numbness, nervousness, and blurred vision. For the additional information from the patient that might be helpful, recently divorced and 35 years old. Recently divorced, we must take this in consideration because the insomnia that the client may feel is due to her anxiety, and when we gave her the diazepam, she might feel calm and doesn't need to take the triazolam. 35 years old because her dosage will depend on her age and condition. For the teaching plan, ma'am, diazepam and triazolam both increase sedation. So, combining these two medications can slow the bodily processes and the brain activity, which can result to a slow breathing, unconsciousness, or even death. Take triazolam only when needed and when you are getting ready for several hours. Do not increase your dose or use this drug more often or for longer than prescribed, because increasing your dosage will not improve your condition faster. It will just increase the side effects. Do not stop using this medicine suddenly, because you will you will have withdrawal symptoms. Ask your doctor how to safely stop using this medicine, and also ask the doctor if you feel that this medicine is not working as well as usual, or if you think that you need to use more than the usual. Avoid the use of alcohol while being treated with this medication, because alcohol will increase the effects of the medication. You may feel more drowsy, tired, or dizzy. Avoid activities requiring mental alertness such as driving, until you know how the medications affect you. Avoid eating grapefruit or drinking grapefruit juice, because the grapefruit can increase the side effects of this medication. Do not use if you are pregnant, because it can harm an unborn baby and can cause birth defects. When you miss a dose, take the missed dose as soon as you remember. Skip the missed dose if it is almost time for your next scheduled dose. Do not take extra medicine to make up the missed dose. And lastly, if you have any questions or concerns, just ask your doctor. That's all. Thank you.